I really love doing these podcasts with you because we get to catch up with each other and we're sort of like forced, or you're forced to talk to me throughout the week to plan the
Yeah,
podcast and record it. So it's really been a lot of fun.
it has been fun. And I'm also excited because I get to check in on JJ every week. So, how is little man doing?
He's doing good. He's currently napping. I'm watching him.
I think that's the time when we get to record podcasts. Hurry, JJ's taking a nap. Let's record.
Yeah, but he has not been sleeping great in his crib, so we transitioned him out of the bassinet into the crib, and we're trying to sleep train him, but he doesn't do so great. So it's been fun not getting a lot of sleep, but it's okay.
Yeah. Sorry.
That's okay. It happens. We'll get there eventually. He's not gonna not sleep before he goes to college. Hopefully, before he goes to college, we'll get him sleeping good in his own room.
Yeah, that's right. Your little brother, the youngest, slept in my room until he was like 6 years old. I think it was
Mhm.
awful.
Yeah,
Yeah.
it happens. I have patients who
Yeah.
are like 16 and still sleep with their mom. So
Okay.
mm,
Yeah.
it
Don't do
happens.
that. Don't go there. That's another episode because that's not what we're talking about today. In this episode, we're going to talk a lot about headaches. Primary headaches, migraines, tension headaches, and cluster headaches. Because headaches they're really common in general, and they're also really common in pregnancy. So I want to tackle this topic today and really focus today on primary headaches syndrome. So primary headaches are ones where the headache itself is the problem. A secondary headache syndrome is when the headache is caused by something else, some underlying disorder. Of course, the most common one in pregnancy would be preeclampsia, right? We've
Yes.
all heard of that. And among pregnant women who do not have a history of headaches, if they get a new headache or worsening headaches during pregnancy, about a third of those are going to be due to preeclampsia. So if you are more than 20 weeks pregnant and you have a new headache, or if your headache is worse than your typical headaches, then you definitely need to be evaluated promptly for preeclampsia. So we're going to start there.
Yeah. And that can be an emergency situation. So if that's you, please go see your doctor and get checked for preeclampsia. Um, you might be in denial about having it like I was, but it can happen
Yeah.
to anyone. So if you're having bad headaches, please get checked. I know, we're not really talking about preeclampsia specifically in this episode, but pregnant women who are over 20 weeks pregnant with new or worsening headaches, you really need to go see your doctor because that can be a sign of preeclampsia. We're not going to talk in this episode about all of the diagnostic criteria for preeclampsia, but the first thing is elevated or high blood pressure. Preeclampsia involves high blood pressure in pregnancy, and it can be a medical emergency, so you want to make sure you see your doctor.
Right, right. So today we're not talking about secondary headaches. Also, secondary headaches could be caused by things like strokes, blood clots, an aneurysm. And those things are not very common, but of course they do happen. So if you have a new headache or a worsening headache, you should go see your doctor right away. Okay, so let's get to today's topic, which is primary headaches. We all know that headaches are really common for women, especially, and especially women in their childbearing years. I read one study that about 60% of women under the age of 40 reported experiencing a headache within the previous year. So they're really super common. And primary headaches are usually what we physicians would call pre existing headaches, meaning that they were around before the patient became pregnant. And that's actually the case for most women who have headaches during pregnancy. Most of them also had headaches prior to getting pregnant. But of course, it is possible to have headaches for the very first time during pregnancy and also during the postpartum period or even while breastfeeding.
Yeah, exactly. So the three major types of headaches that we want to talk about today are migraines, tension headaches, and cluster headaches. So let's kind of start off with migraines. if that's
Okay.
okay. I know that migraines are most common and the most frequent type of both pre existing headaches and headaches in pregnancy that start within pregnancy. They account for 90% of primary headaches in pregnant women. And in general, migraines are pretty common. I know lots of people who get migraines. Um, Actually, my brother Matthew gets migraines.
Right. Yeah.
So the lifetime prevalence of migraines for pregnant women is around 30%. So that means that 30% of pregnant women will have migraines during pregnancy, and about 2% of those, so not a lot, but still some, will develop their first migraine during pregnancy.
Right. And if that happens, it's usually during the first trimester when we see that happen.
Okay, so tell us, I know because I diagnose them in kids all the time, but tell us, what are some of the characteristics of migraine headaches?
Okay, so 60 to 70% of migraines tend to be unilateral, meaning it's on one side of your head and in one spot. The other 30%, though, can be either what's called bifrontal, so both sides in the front, or global, where it's your entire head that's hurting. Most of the time, migraines, though, they tend to be just in one spot. They typically have this gradual onset. They start slowly and then increase in intensity, and they can be pretty severe in intensity. So it just kind of creeps up and keeps increasing and increasing until it's debilitating.
Exactly. And I've heard some patients describe them as like pulsating in nature. For kids, it's kind of hard for them to explain how they feel, but
Right.
I have heard some of the older kids say that they're pulsating. I also know that they tend to be made worse by physical activity. And people who get migraines often, one of the only things that makes it better is going to lay down and rest in a dark, quiet place. A lot of patients say that even routine activities, things they do every single day, can make the headache a lot worse. So just laying down
Yeah.
in a place that's dark and quiet is one of the only things that can help.
Right, exactly. And, headaches can last from 4 hours up to 72 hours, so it's like 3 days. They're often accompanied by nausea, vomiting, and photophobia, which means light makes it hurt more, or phonophobia, where sounds make it hurt more. And some people get like an aura where they may see things such as flashes of light, or maybe some people hear things that signal them to know that a migraine is coming.
Exactly. Yep. So tell everybody kind of what are some of the things that can trigger a migraine.
Yeah, lots of things, but obvious things like stress, right? I mean, and who doesn't have stress, especially when you're pregnant? But
Mhm.
sometimes changes in the weather can trigger a migraine, sleep disturbances, and even things in your diet, like eating extra nitrites in your diet, can be a trigger for migraines. Now, the good news for women who suffer from migraines is that for most pregnant women who have migraines prior to getting pregnant, 60 to 70% of those are going to report that their migraines actually improve over the course of their pregnancy. And that's because migraines are often influenced by fluctuations in estrogen levels. And during pregnancy, your hormone levels tend to settle down and remain pretty stable throughout your pregnancy. So the vast majority of women who have migraines are going to experience an improvement in their migraines during pregnancy.
That's great. I really didn't know that, honestly. So, for all of the women out there who have migraines, we have a great treatment option for you. Just get pregnant.
Right.
Have all the
That's a great
babies.
idea. Yeah. So, unfortunately, however, 5% of women who have migraines before pregnancy will experience a worsening of their symptoms during pregnancy. And then about 25% are not going to really notice any significant change in their migraines. So, it's not a definite cure, Rachel.
Oh man.
But those who are most likely to have improvement in their migraines are the women who get what we call menstrual migraines, or migraines that are worse at certain phases of their menstrual cycle, or migraines that are often triggered by their period, right? Those women will often have a significant improvement during pregnancy. Well, for one, they're not having periods, but also, um, the ones who don't typically have an aura, and those who experience improvement in the first trimester are likely to have improvement throughout their whole pregnancy.
Awesome. That's great. So, if your migraines get better in the first trimester, that's likely to persist throughout the rest of your pregnancy. And if you don't, then it's not likely to get much better. Um,
Right,
and like most things, when we say improvement, you're using the word improvement. So to
right,
me, that doesn't mean that you will have no headaches the whole time
right,
you're pregnant, but your headaches may be less frequent. Like you might have 5 a month instead of 10 a month. They might be less severe. So, maybe they don't hurt as bad, or they may not last as long. So, like if they were lasting 10 hours, maybe they only last 2 hours. They're just
right,
really not as bad as they were. So,
right,
let's say a woman has migraines, they get better during pregnancy. What happens after pregnancy? Do they normally
right.
come back? What happens?
Yeah, so the most common time for migraines to recur is going to be in the postpartum period, especially for women who had those menstrual migraines and then had a reprieve during pregnancy. They are most likely to experience postpartum migraines, and that's related to, again, the fluctuations in their estrogen hormone level. Now, one good thing is that if you breastfeed, okay, that keeps your estrogen levels lower. And if you breastfeed, you're going to be less likely to experience postpartum migraines if you're breastfeeding. So it's kind of a protective effect.
That's great. I didn't know that either.
Mm,
So, women who suffer from migraines during pregnancy, are they at an increased risk for other problems during their pregnancy too?
Great question. Yes, they are. And interestingly enough, it doesn't matter if you treat the migraines or if you don't treat them. If you just suffer through them, you still are going to be at increased risk for hypertensive disorders of pregnancy. That includes things like gestational hypertension and preeclampsia. And it's a pretty significant correlation. Having migraines in pregnancy significantly increases your risk for developing hypertensive disorders of pregnancy. And also, there have been some studies that suggest that women who have migraines in early pregnancy may be at a higher risk for miscarriage or preterm birth or low birth weight babies. But there was no increased risk for any kind of congenital anomalies or birth defects.
Okay, well, that's good. So, women who have migraines during pregnancy may be more likely to have high blood pressure problems during
Right,
pregnancy. And that happens, if you treat the migraine or if you don't treat it. That's
right,
kind of what I heard you saying. I
right.
think it's important to treat headaches, during pregnancy because you want to be more comfortable. You're really
Absolutely.
uncomfortable anyways most of the time. So what's the point in being extra uncomfortable? You really don't have to suffer. There are treatment options. You don't have to suck it up and take it just because you're pregnant. I know that a lot of women really want to avoid medications during pregnancy, and I totally get that. But I hope people understand that you don't have to suffer with your headaches just because you're pregnant.
Yeah, and, so the problem with medications, right, is that we don't have large clinical trials or randomized controlled studies looking at different medications and therapies to treat headaches in pregnancy, and that's because pregnant women don't volunteer for studies, right? And of course they wouldn't. I wouldn't either if I was
Yeah.
pregnant, right? So
Nope.
as doctors, we have to base all of our recommendations on looking back to see what has happened when women tried the treatments during pregnancy. And we're basing our recommendations on how the medications impact pregnancy and babies. So, of course, we're going to avoid anything that we know is potentially harmful during pregnancy. And then after that, we follow treatment recommendations that are similar to the recommendations for non pregnant women. So, as doctors, we choose the medication that has the best safety profile for the baby and then try to limit the number of medications that we use. We limit the number of doses also to the minimum amount needed to control the symptoms so that the patients feel better.
Yeah, exactly. So we start with the least risky drugs and take it for the least amount of time possible to control the symptoms. But we can increase the dose if needed to help you feel better. Also, there's going to be some trial and error, as there are with most things. You may have to try a few different medications to figure out what works best for you, and it may require some time to kind of figure out a regimen that works best. Okay, so let's talk about some of the specific treatments. Let's start with non-medication treatments. Tell us a little bit about those things first.
Absolutely. So there are a lot of things that you can do to help, like using heat or ice, a warm washcloth or a cold washcloth on your head. Massage has been shown to help. Of course, rest and sleep, right? And avoiding triggers. So maintain a regular meal schedule, what you eat, a regular sleep pattern. Also, there are a lot of other things like biofeedback that can help. And you can be trained in relaxation training as well as things like cognitive behavioral therapy. Those are all proven strategies to help reduce headaches. Of course, they take a little bit of work on the patient's part, and sometimes that can be a little bit challenging. But I find that pregnant women are often motivated to do more of these non medical interventions, right?
Yeah. Yeah, like making sure you're getting enough sleep too. Um,
Right,
yeah, not using electronic devices, like not using them right before bed, so that
right,
you can sleep better, but also not using them consistently for like hours and hours on end throughout the day if you can help it too, because that can trigger headaches. And then using like the blue light blocking glasses,
right,
those can be things that are kind of like easy relatively to help with headaches. Okay,
right.
so let's talk about medications. And I think every woman who has been pregnant knows that the first line medication that we use for just about everything in pregnancy, all types of pain, is going to be acetaminophen, which is the generic for Tylenol. And I hated that because I thought ibuprofen worked so much better. And I'm so used to taking ibuprofen, and I had to switch to Tylenol, and I just felt like it
Right.
didn't work as well. But hey,
Right. Well,
what
they
can you
work
do?
by a different mechanism, obviously. But for migraines, we usually recommend that women start with the extra strength Tylenol, and you can take two of those, so up to 1,000 milligrams at once, and then just follow the directions on the bottle in terms of how frequently they can be taken. So acetaminophen has generally been proven to be safe during pregnancy. Now, if the acetaminophen itself doesn't work, then we can add other things with it. We can add Reglan, for example. Now, that's a medicine that we often use for nausea because it promotes GI motility. It can also help with headaches. We can add codeine. Codeine is a narcotic, so we are always really careful about that. And we like to limit narcotic use for obvious reasons, but also some women use it a lot because it works really well. And then they can develop what is called an overuse headache, meaning they take the medication on a regular basis. And if they stop it, then they get rebound headaches. So they just keep taking it. Not good.
Yeah. No, yeah. And also codeine can cause withdrawal for the baby if it's used near the time of delivery, near term. So you have to be really careful about that too. Any narcotic medication can lead to withdrawal symptoms for the baby if it's used too close to delivery. I wanted to
Absolutely.
say another thing about Tylenol. There's been a lot of rumors about Tylenol causing autism in babies. This has not been
Mhm.
studied, and there is no correlation that we have found between the two. So I think it's just people trying to make everyone anxious. I don't know why you want to make a pregnant woman anxious. They're already more anxious.
We're anxious enough. Right. I
You're
agree.
taking away the one medicine they can take that really does anything. So there's no basis to that. There's no studies that have been done that have proven that. So don't let that make you nervous to take Tylenol.
That's good to know. That's good to know.
Mhm.
All right. So another medication that is often used in pregnancy is a medication called Fioricet. It is a combination of butalbital, acetaminophen, and caffeine. And it really works very well during pregnancy. It also can result in medication overuse headaches if it's used too frequently. So it should really only be used for 4 or 5 days per month to reduce the chance of negative outcomes. Now, I mentioned that Fioricet also has caffeine in it. So I do often have some patients who will just take Tylenol with a cup of coffee and find that that combination also can be pretty helpful.
Yeah, and actually, there's another medication on the market. I was prescribed butalbital for different types of headaches that I was having at one point, and there's another medication. It's Excedrin tension headache. That is a combo of Tylenol and caffeine. So
Oh,
it's very
awesome.
similar. Yeah, and you can find it anywhere, and there's even generic brands at Target. And I always found that the medication worked really well for my headache. So definitely try that. As long as you're consuming 200 milligrams of caffeine or less a day, then you can safely take the amount in the Fioricet or the Excedrin tension headache tablets. It's usually about 50 milligrams. So don't stress about taking the medication with caffeine. Just make sure you add it into the caffeine that you're doing daily so you're not going to exceed your limit. But really, the 50 milligrams is a low dose of caffeine, so
Right,
you should
right.
be okay to take it.
Now, I do want to say this. If the Fioricet doesn't work, if the Tylenol and the caffeine don't work, if the codeine doesn't work, then for short courses, we can use NSAIDs in pregnancy. So, in general, they're avoided during pregnancy because they can affect the baby's kidneys, right? And they can cause closure of the ductus arteriosus if used in large amounts. But generally, if we give them for a short period of time and not in the first trimester, then they can actually be pretty safe. We do know that in the third trimester, they can affect baby's kidneys. So we don't use it then. And generally, I recommend that you not use
Mhm.
ibuprofen at all during pregnancy unless you have talked to your doctor first. But I sometimes will recommend it for a short course for patients who have intractable headaches. Now, if all of those treatments don't work, then we can use opioids like oxycodone or hydrocodone. And of course, we don't want to use these medications on a chronic basis because they can be addictive and they can lead to withdrawals in the baby, right?
Yeah, exactly. We definitely don't want to use those too much. And the same with ibuprofen. If you're in the second trimester and you've talked to your doctor and they're saying you are okay to take this for a little bit of time, then, trust your doctor and go ahead and take it. So, Mom, I know for migraines in children, when I diagnose them, sometimes I'll do a triptan, like sumatriptan or something like that. What um, you know, they are the most common meds to use to treat migraines. So do you use those?
Yeah, absolutely. So they are very effective in treating migraines. And a lot of women that come to me that are pregnant are already on them. And of course, we can continue those in pregnancy, they are safe. But typically, if I'm going to start a woman on a triptan during pregnancy, I like them to have a consultation with a neurologist who's also going to be treating them because they're more likely to need the treatment after pregnancy as well. And that's not something I'm going to continue in a patient after they've delivered their baby. So I will say that the experience that we've had with sumatriptan in pregnancy has been reassuring. There's been no increased risk of congenital anomalies or early pregnancy loss reported. And again, we don't have a lot of medical studies, but all of the retrospective data that we do have support that those medications, the triptans, are safe to use in pregnancy. So, my patients who are pregnant, who have severe, long-standing migraine headaches, I definitely will have them on those kind of medications. And I want to work in combination with their neurologist also to come up with a plan that works best for the patient, right?
Yeah, that's great. So what about other meds that may help women with migraines? I know a lot of women have nausea and vomiting with their migraines.
Right.
What do you do for those symptoms when women
Right,
have those?
absolutely. So I'm often prescribing meds like promethazine or Zofran or Reglan, and they can be used to help with the nausea that accompanies migraines. No doubt. So a
Okay.
prescription for one of those medicines can help.
Perfect. Are there any medications that you would say, no, definitely do not use these during pregnancy?
Yeah, of course, of course. One that comes to mind is ergotamine, which is the generic for Cafergo, and that's absolutely contraindicated in pregnancy because it can induce a hypertonic uterine contraction or a vasospasm that constrict blood vessels to the placenta, and that can cut off blood flow to the baby. So that one is absolutely contraindicated. Midrin, also a real common medication for migraines when women are not pregnant is also contraindicated because it can also compromise uterine blood flow. So don't take that one
Okay.
if you're pregnant.
Okay. That's good to know. So we've talked about a bunch of medications that you can take during pregnancy, and different
Mhm.
levels. So do you ever have patients who don't respond to the ones that we've discussed already?
Mhm. Yeah, absolutely. Every once in a while, a woman will come in with an intractable migraine that's not responding to treatment. And for those women, I often have to admit them to the hospital, give them IV fluids for hydration, and then IV pain medications to get the pain under control. And I also often add magnesium sulfate through their IV, and that can stop an acute headache. We use magnesium to stop preterm labor. We use it in pregnancy. It decreases the risk of seizures in women who have preeclampsia. So we have a lot of information about the safety of magnesium use in pregnancy. And I want to say that many women who suffer from headaches will have chronically low magnesium levels, and supplementation with magnesium can actually help those headaches. So, yeah, so take a magnesium supplement if you're a woman who suffers from headaches, definitely. Now, sometimes steroids can be used in really intractable cases to help with headaches. And again, I usually do that in consultation with a neurologist because if someone has a headache that's that bad, I want them to have someone to follow up with after the pregnancy's over. Women who get really frequent migraines are sometimes put on a prophylactic medication, a medication to keep them from getting migraines. So sometimes we put them on something called a beta blocker, and that can help prevent migraine headaches. And beta blockers are actually medications most commonly used to treat blood pressure, but it works to treat severe cases of headaches, and it can prevent headaches from developing in the first place. They're also proven safe in pregnancy. Sometimes we use calcium channel blockers, kind of the same way. They're blood pressure medications that can also be used to treat headaches. And then another medication that's used sometimes are low dose antidepressants. They can help prevent headaches as well. And then sometimes we use gabapentin. So there are lots of different treatment strategies that we can work on to come up with what works best for each patient individually.
Yeah, it sounds like there are a lot of options. So, I mean, that's
There are.
good. And I think women should be reassured to chat with their doctor that there's so many options. So hopefully they'll find one that'll work. What about natural things that patients can do or like vitamins that they can take to prevent migraines? Is there anything like
Yeah.
that?
Oh, absolutely. So the most common one I recommend is magnesium, 400 to 800 milligrams daily of some kind of magnesium supplement. The one I take is triple mag because there's different types of magnesium. There's mag oxide, mag glycinate, a bunch of different types. Um, Riboflavin, which is one of the B vitamins, 400 milligrams daily. And then some naturopathic people like extract of butterbur root twice a day to help prevent migraines during pregnancy. So there are lots of natural things that you can do to help prevent you from getting migraines in the first place.
Butterbur sounds like something out of Harry Potter or something like that.
It's
Take your
funny. It kind of
Butterbur.
does. Yeah.
um, okay, so we
Uh,
spend a lot of time on migraines because it really is the most common type of headache. But some women also suffer from general tension type headaches or even cluster headaches
mhm.
during pregnancy or postpartum. Um, I know that tension headaches are kind of like the type of headache where there is a pressure or a tightness in the head, and they can often wax and wane where they get better or worse. Sort of unlike migraine headaches, a lot of people with tension headaches really can continue to function and do things that they normally do while they have a headache. Um, Whereas, like with a migraine, they're kind of down for the count for a
Right.
while. Tension headaches last from 30 minutes up to as long as 7 days,
Mm.
which can be frustrating for people who have them. And they usually don't have other associated symptoms. So they really don't get the same nausea, vomiting, or aura where they're seeing or smelling things before they get a migraine, like you would with a migraine. So, um, yeah.
Right, right. And the other thing is, migraine headaches which often get better during pregnancy. Tension type headaches do not change during pregnancy because they're not really affected by hormonal changes. And also, unlike migraine headaches, there does not appear to be any increased risk of hypertension or any adverse pregnancy outcomes associated with tension type headaches in pregnancy. So that's good. Now, the
Yeah.
treatment is fairly similar. We start with Tylenol. Then we can use codeine or Furoset, like we talked about. A short course of NSAIDs in the second trimester can be used. We don't use triptans like with the migraine headaches because those don't typically work for tension type headaches. So I usually am going to stick with the Tylenol or the Furoset. Now, also the non-pharmacologic treatments we talked about, like avoiding triggers, getting sleep, etc., those can all be really helpful too. And sometimes things like physical therapy or a massage can actually help as well.
Yeah, actually, if you don't know, I'm a DO instead of an MD. So I studied
Yeah, the
osteopathic
manipulation.
medicine,
Right.
and there really are some things that can help from like an OMM standpoint for tension headaches. So one of the things that we talk about is a lot of times tension headaches are from tightness in the muscles in the back of the neck, or your blood pressure kind of pushing blood up into your head and neck area. And so if you roll up a towel and kind of put it behind your neck, it can not just kind of lower the amount of blood that's flowing up to your head, but also it can make kind of like put pressure on those muscles and make them be less tense. So it can help with tension headaches in that respect.
Hmm.
So just roll up a towel and kind of lay on it with it pushing right on the back of your neck right there. And a lot of times, if you go see a DO, doctor, an osteopathic physician, they can kind of help you with some other osteopathic manipulation techniques as well. So I'm sure physical therapists would do something very similar as well. So
Right.
and probably a massage therapist as well. So
Right. Yeah.
there's
Yeah.
lots of options that aren't taking medicine for tension headaches, which is nice.
Right.
But the last type of headache that we're going to talk about is cluster headaches. And cluster headaches really aren't very common. I don't know that I've ever seen a patient have one. They usually begin around the eye or the temple, and they're always on one side. And the pain typically begins very quickly, and it gets to its peak within a few minutes. And it can be really, really excruciating pain, but it really doesn't tend to last for very long, which is good. Um, and a lot of women can generally remain active while they're having a cluster headache as well, unlike with migraine headaches. With cluster headaches, the common associated symptoms are tearing or redness of the eye on the same side as the pain, and sometimes a stuffy nose, sweating, or even like restlessness and agitation. All those things can really happen.
Right, right. And cluster headaches are not that common, and they are not affected by hormone changes. So, pregnancy is not going to have any effect on the number or severity of cluster headaches that you get. Because they're not that common, their pregnancy effects are not as well studied as the other headache types. However, we do know that the treatment for cluster headaches can be a little bit different. And actually, the first line of treatment is inhaling oxygen in higher levels. That can actually stop a cluster headache. So, the first line treatment is going to be oxygen therapy. The second line treatment is triptans, like the sumatriptan and the Imitrex. Those are also helpful for cluster headaches.
Yeah, I've actually, like I said, I've never seen a cluster headache, but that is like a really common board question is if they're having a cluster
Yeah,
headache, you treat it with oxygen. And so I feel
yeah.
like anyone who went through med school, you're going to know that for sure. It's always a board
Right,
question. And if you're
right.
studying for boards, remember that.
Remember that.
Okay. So let's finish up by talking a little about postpartum headaches. I know that just like during pregnancy, we still have to consider preeclampsia when someone has a headache postpartum.
Right, that's right. Preeclampsia can happen in the postpartum period. Definitely, I see it a lot. Usually, it's going to happen within the first 48 hours after delivery, but sometimes it can be a week or even longer postpartum. So, if you have a postpartum headache, the first thing to do is make sure it's not preeclampsia. So, definitely get your blood pressure checked. Now, in general, in the postpartum period, there are many changes taking place, right? There are significant hormone changes. Many women are sleep deprived, right? Or you may not be eating on a regular schedule. It can be really stressful and you're exhausted. So, all of those things can increase the risk for headaches to happen postpartum. So, don't be surprised if headaches return postpartum or if you start to have headaches in the postpartum period, because honestly, it's just a really hard time. Now, as far as what type of headaches are going to happen, if you had migraines in the past, then they're likely to return in the postpartum period.
Oh, boo.
Boo.
So, what are some of the treatment options for migraines in the postpartum period?
Yeah. So if you're not breastfeeding, then you can take all the same medicines that you were taking before pregnancy. And if you are breastfeeding, then you need to be a little bit more careful about the medications and how they may affect your baby.
Yeah, and that's something you can bring up with your OB when you see them, or you can chat with your pediatrician about it too. Most of us are pretty knowledgeable about what medications you can or can't take while you're breastfeeding. But really, in general, you're going to be able to take most of the same things. Tylenol is safe while you're breastfeeding, so you can definitely use that. And unlike during pregnancy, those NSAIDs are safe while you're breastfeeding. So Motrin, ibuprofen, Aleve, Advil, all of those medications are totally fine while breastfeeding. You do need to be a little more careful about using codeine or any of the narcotic meds because they can make babies more sleepy. But we use narcotic pain meds for women who have had C-sections all the time. So you can use them while you are breastfeeding. You just want to limit how much you're using them and be more careful. If you have more specific questions about triptans or other medications that you're taking postpartum while you're breastfeeding, ask your OB or your pediatrician. We're more than happy to answer your question, or if we don't know, look it up for you.
Right. And another thing that can happen postpartum that some people are really surprised about is something called a post-dural puncture headache. And we blame John for this, right, Rachel?
Yeah,
And
exactly.
that
100%.
so that this is a headache that can happen to women who have had a spinal or epidural anesthesia. And thank goodness it doesn't happen very often. But typically, if you're going to get it, it will develop within 48 hours of having the spinal or the epidural. A headache with this type of condition is worse when you stand up or when you sit up in bed, and better if you lie down. It usually improves with rest and laying down. It typically does not have nausea or vomiting. It's caused by a little bit of your spinal fluid leaking out when you have the spinal or the epidural placed. And if you get this, your doctor may recommend caffeine, they may recommend hydration, and maybe something called a blood patch. And I know this sounds a little bit crazy, but a blood patch really works. The
Mhm.
anesthesia provider, they'll take a little bit of your blood, of your own blood, and then inject your blood around the spot where you had the epidural to create a seal so the spinal fluid doesn't leak out anymore. And it actually works incredibly well, like almost immediately. Works great.
Yeah, I've actually John has been called in a couple times to place blood patches on people. And it's kind of like you can imagine if you get like a scratch or, like if you inject something into your skin, like if you get a shot or something, and then when you take the shot out, a little bit of, blood's going to leak out. But the blood kind of seals it up, right? Like if you get a scratch, your blood's going to form a scab. It's sort of like that. Your blood kind of like heals over so that the spinal fluid's not leaking out still. And usually it works really, really well. But be really careful not to freak out and think you have a spinal headache. I have a lot of people who freak out thinking they have a spinal headache when
Yeah,
it's just a headache from maybe being exhausted, not drinking enough water
right.
after pregnancy. So, those little things that you talked about, like being better when you lay down and worse when you sit up, really monitor for those things. If you're having sort of those symptoms, then chat with your doctor about, hey, could this be a spinal headache? And it's really normally a bad headache,
Yeah.
really bad. Okay, so the last thing that we should mention is that there are a few signs and symptoms associated with a headache that really require very prompt and thorough evaluation, because they can be a sign of something more severe. Usually, your
Mhm.
doctor will call these the red flag signs. So, if you have any of these, you really need to be evaluated pretty quickly. Obviously, if you have high blood pressure, if you have altered mental status meaning like if you're confused, you don't know where things are, um, sort of that kind of thing. Or also if you have a seizure, obviously, right?
Right.
That
Yeah.
need immediate medical attention. So high blood
Right.
pressure, altered mental status, you don't know where you are, or having a seizure. But other things too, like if you have a stiff neck, that can be a sign of something more scary. So definitely chat with your doctor. Or if you have something what we call focal neurologic symptoms, focal meaning like in one spot, and neurologic symptoms meaning something's not quite right in this one spot. um,
Mm.
so, for example, if your whole arm goes numb, that would be
Yeah, that's
something
not
we would
normal.
want to be evaluated. Yeah, something's not quite right here.
Right.
We want you to get that evaluated promptly. Also, if it's like the worst headache of your life, then definitely go get it evaluated quickly. Or if you have a fever, if you have had recent trauma, like if you fall and hit your head, both of those things you should probably get checked out. Um, or if you were exposed to some sort of toxin, um,
Right.
this is all a reason to get checked out right away. If you get a severe headache while coughing or exerting yourself, like just walking up the stairs, you get a horrible headache. Or even if you get a really bad headache with sex or sexual activity, go get checked out right away. These could indicate something that's more severe than just like, hey, you need more sleep or something like that.
Right.
Um, if you have a headache that doesn't go away with pain medication, that's another thing too. Definitely call your doctor. Or if this is a big one too, if your headache wakes you up from sleep,
Yeah.
usually, if anything wakes you up from sleep, that's a sign that you should tell somebody. So, if your
Yes.
headache is waking you up from sleep, check with your doctor. All these things may be okay. You may just be getting headaches because you're tired or you need to drink more water, but they can also be a sign of something more severe. So, go get them checked out.
Right, right, and you can always go to the emergency room, if your doctor is not in the office, if it's the middle of the night, and
Yeah.
often if you have one of these, complaints that Rachel just mentioned, often you might need some sort of imaging procedure in order to
Yeah.
evaluate your headache better. So you may end up getting an MRI or a CT scan, and please do not be afraid to get those done, even during pregnancy if you need to have them. An MRI is always safe in pregnancy. First of all, it's magnetic resonance imaging, so no radiation at all. And the CT scan, with that, the X ray beam is very focused. And if they're imaging your head, it's not directed toward your belly or the baby. So, really, the baby is not getting the X ray radiation. If they're scanning your head during pregnancy, the risk of exposure to your baby from radiation from imaging your head is extremely low, very, very low. And also, we can't have a healthy baby if we don't have a healthy mom.
Yeah.
So go get the scan. And similarly, if your doctor suspects that you might have an infection of some sort, like meningitis, maybe, they might recommend a lumbar puncture. And the risk of causing any problems for baby is exceedingly low, and it can give some very important information to guide your treatment and your care. So we have to take care of mom if we want to have a healthy baby, right?
Yeah, exactly. And we want to take care of mom while she's pregnant, but also after
Right.
pregnancy too. Like I stress this so much with my patients and their parents. Like, I need you to be healthy to be able to take care of this baby that's my
Right.
patient,
Right.
because my baby can't make it on its own. So
Right.
I need you to be able to do that. Let's recap a little bit. Headaches are common in general. We all know that.
Mhm.
But they can also happen in pregnancy too. For primary headaches, that is the headaches that don't have an underlying condition that's causing them. Migraines, they're the most common primary headache. Thankfully, they do get better for most moms during pregnancy, but for some people they don't, and then they often return postpartum. Women can also have tension headaches or cluster headaches during pregnancy, but these are less common. Start with Tylenol for treatment. If you need something more than just the Tylenol, then talk with your doctor. And, she might recommend, or he might recommend, that you potentially talk to a neurologist to come up with a plan that works best for you. It's important for you to feel really good during your pregnancy.
Yeah.
There's so many things that are trying to make you feel miserable when you're pregnant. So don't add to that. So don't
Yeah.
forget that non-pharmacologic methods such as rest, hydration, water, sleep, heat and ice, and relaxation techniques, all those are really good treatment options as well. If you do have high blood pressure and that is adding to your issue of your headaches, get evaluated for preeclampsia. 100% preeclampsia is an emergency. So if you have
Yeah.
high blood pressure and headaches, talk to your doctor. Also, if you have associated symptoms like fever, stiff neck, if it's the worst headache of your whole entire life, or if it wakes you up from sleep, then go get evaluated right away. And if you need tests like an MRI or a CT scan or a lumbar puncture, then just get the test because it's important.
Perfect.
Did
You
I get
got
it?
it. You got it. You got it all. Those were all the points. Perfect. So I think that's all we have for today's episode. I'm going to say thank you for joining us. Please join us again next week for another episode of the Mama Doc Baby Doc podcast. And do me a favor and share this podcast with a friend if you like it. Also, to our listeners, please subscribe to our podcast wherever you're listening